started, most notably in South Korea and Germany. Then came China's announcement that it plans to test all 11 million of Wuhan's citizens after a fresh outbreak in the city where COVID-19 originated. We'll ask about that and about not so great news out of Geneva. The World Health Organization warning that the new coronavirus pandemic may be here for good. And even if a vaccine is found, controlling coronavirus will require, quote, a massive effort. Does that mean replicating on a global scale what the South Koreans have done with draconian tracking of all citizens and an army of contact tracers? The high road to a dystopian future where we're policed in our every movement? Or are we talking about the path to liberation from a life of lockdown? Today in the France 24 debate, we're looking at the prospects of that second wave on a planetary scale. With us to talk about, we want to welcome back from Newcastle in the UK, Dr. Stereos Moskos, Associate Professor of Cellular and Molecular Sciences at Northumbria University. Thanks for joining us again.
Thank you very much.
Anne-Sophie Saint-Père is in Paris. She is Advocacy Officer for the Liberties Program of Amnesty International. Welcome to the show.
Hi.
And keeping a very close eye on what's doing in her native South Korea, France 24's very own Vienna Lee, also in the French capital. How are you?
Hiya.
The France 24 debate, where you can join the conversation on Facebook and Twitter, the hashtag F24debate. For those who aren't glued to the news cycle, it's kind of rough waking up this Thursday morning and listening to this.
This virus may become just another endemic virus in our communities, and this virus may never go away. HIV has not gone away, but we've come to terms with the virus, and we have found the therapies and we've found the prevention methods, and people don't feel as scared as they did before. And I'm not comparing the two diseases, but I think it is important that we're realistic, and I don't think anyone can predict when or if this disease will disappear. We do have one great hope. If we do find a highly effective vaccine that we can distribute to everyone who needs it in the world, we may have a shot at eliminating this virus.
But again, as he says, even with a vaccine, it's going to be the new normal for a long time to come. Stereos Moskos, I've spoken to a lot of people here in France who are, they're feeling a bit blue because they thought the beginning of the easing of lockdown, which, by the way, you haven't even reached where you are in the UK. They thought, it's going to be a beginning of a return to normal. We're not seeing the light at the end of the tunnel yet.
No, I'm afraid that's squarely not the case. Unfortunately, we had here the announcement in the UK on Sunday that people should start feeling a little bit more cautious, but more enabled. So the stay alert sort of signal that was given by the UK government to start exiting the lockdown. And I'm afraid the data, and I've always been somebody who studies the data, not opinion or policy by principle of ideology. It's basically that we need to have a clear sight of the end of transmission before we actually start to move things around.
All right, let me ask you on that point. The Pasteur Institute here in Paris has come out this very Thursday with their latest data, and let me read it to you. Back on the 21st of April, for every person who caught coronavirus, 0.5 were getting it. Now they've adjusted the data, and they find that it's 0.67, so slightly higher. Okay. They were hoping at the time that on the day of deconfinement, as we're calling it here, May 11th, we'd be down to 3,000 cases. We were at 3.9 thousand. All right. But here's the real zinger in all of this, Stereos Moskos. They're saying the percentage of the population here in France who's caught it is 3.9%. We're a long way from herd immunity.
Yeah, no, this is really bad news, to be perfectly honest. Bad news in the sense that for the concept of having people exposed, potentially protected, and again, we don't know if that is possible as yet, and then to to have the people milling out about the daily business, you really need a lot more. Now, I don't know exactly what the numbers are in France in terms of people hospitalized and people that have lost their lives because of coronavirus. But I know it's 27,000 in Spain, for example, and there the percent of people that have got it vary between 5 and 11%, depending on the density of the city. So in Madrid, they've had 11% approximately infection rate, and they've lost 27,000 people. So if we sort of do the math, you can see that we're nowhere near a situation where we can just let people loose, even with reasonable measures of self-protection, even with in a society where people will wear masks to prevent others from getting the disease, because there will be transmission again, and we will be back where we are now, if not worse, very, very quickly.
And Sophie Saint-Père, let me ask you on a personal question here. As a Parisian, what's it been like this week? What's your mind frame?
I mean, it didn't really change so much since the deconfinement. I mean, I think people are still very cautious. And of course, now most of the people in the street, I mean, at least in my neighborhood, are wearing masks. So I think there is an understanding that you have to be cautious, and we want to limit the transmission in the coming weeks.
Yenna Lee, is that the same for you? It's a little different for you, isn't it? Because you have the pass, you're able to go out and about and report. But when you compare with the mind frame here and the mind frame in South Korea, did you see it coming that, well, deconfinement would be a bit of a downer?
Well, it's been a bit disappointing to see what's happening back in South Korea, actually, because it was doing so well, and now there's been a bit of a second outbreak, a major one. But that said, when you're going back to what you were saying about Paris and the permission slips and leaving during rush hour, my friends back in South Korea think it's absolutely insane that I wasn't allowed to leave the house without a piece of paper for so long. And even now, if you want to go out during rush hour, we still need that piece of paper signed by our employer to be able to use public transport. And back there, they find that it's like unbelievable.
All right, so yeah, we'll compare that with what's going on here. Yeah, there was another. This was supposed to be this Thursday, a big date promised by the French government, Stereos Moskos, this pan-European study on what are effective remedies for COVID-19. In particular, one that's made a lot of news here and in the U.S., hydroxychloroquine, the active ingredient in anti-malaria and anti-lupus drugs. And Discovery has been branded by some French media as fiascovery, well, I guess a play on words with fiasco, because, well, they haven't released much. There's just not enough samples out there. So this idea that you and I talked about last time, that we would have this, that, you know, we'll gather the data from around Europe, we'll get our act together, and we'll know as much as possible. It hasn't panned out?
So it hasn't panned out because we haven't got enough results. And that's really, really important to understand from a lay perspective. I can toss a coin many times, and if I toss it 3 times, I'll probably get maybe 2 heads and 1 tail. But if I toss it 1,000 times, then I'll probably get half of them being heads and the other half being tail. On the odd time, maybe I might get one standing on its edge, but you know, that's very unlikely. The same problem applies to when we're doing studies on medications, and the more complex a system we're trying to study, the more complex and larger the number of samples that we need to get. Now, we've seen some data being produced by groups worldwide around these medications, and one thing I can tell you hand on heart is that with the aged population in the United States, where hydroxychloroquine has been given as a treatment, there was an observation of a twice higher risk of death in these patients. That's a very small study. It's what they reported though, and that's the data that has come out that's well done, well studied, and openly presented. We need to be patient with the Discovery study. We could request that the data is released openly and everybody starts to draw their own conclusions as the numbers move. But in reality, that's not the right thing to do. And I'm working in this field right now, not in the Discovery study, but much as I have sight of what's happening on a day-to-day basis with the samples, and some of the data is actually really encouraging, I can't turn around and publicly say it works or it doesn't work for what I do, because not everybody will be able to appreciate the nuance behind what I'm studying and how this might change literally as the numbers increase. So patience is necessary.
Even what you're studying shows how slow it's going, because what you're studying, if I understand correctly, is whether or not the testing is effective.
That's right. So my study, my research is on whether or not we can replace these nasal swabs, which are sort of in the back of your nose, with a sample that's basically your breath, maybe up to 2 minutes of breathing. And we've got good reasons to believe that there's a decent enough sample in that so that we could detect the virus. The problems we are encountering actually are more to do with logistics and bureaucracy now, and they're less to do with identifying individuals that could be tested for this. So we've got 7 clinical centers in Europe and the United States who have signed up to help us see whether or not this is something useful. When it comes to testing people who are suffering from coronavirus and they're in ICU, and their clinicians are treating them in the best possible way they see fit, sitting down and looking dispassionately at the numbers and saying, does this person fit the criteria that we want to for including a patient in the trial or not? You suddenly see that the numbers start dropping out. And although you may have 10, 20, 100, 200 people in your ICU unit, maybe whole countries wide, the numbers that you can actually include become a lot less. So the challenge is quite high, and we must not underestimate that.
And again, getting back to what the World Health Organization said, we saw with SARS in 2003, we thought it would come back with a vengeance in the fall. It never returned. We're still not quite sure why. We have no idea what's going to happen in a month or 2 months or next year, do we?
Well, if you're asking me, there's no such thing as a prediction in infectious diseases. But what we can do is look at what's happening right now across the world. SARS had a very, very narrow area of transmission, whereas now coronavirus 19 is a global pandemic. One of the arguments that's been raised is, the summer is not the right season for infectious diseases of the nose. We should be able to get away with it. Unfortunately, the weather right now is pretty good in Singapore. South Korea, I think, is actually fairly all right. It's certainly improving here in the United Kingdom. But if you look at the parts of the world where we have transmission ongoing right now, Brazil, again, Singapore, the weather is perfectly fine, and that's not stopping transmission. So it would be important to appreciate that this is not SARS, this is SARS-CoV-2. It's a different virus. It looks like it's behaving differently. So why don't we apply what we know works from countries like South Korea, like Singapore, like Taiwan, like Vietnam, like New Zealand, to the rest of the world?
I'm going to ask Yenna Lee about South Korea, but first we're going to look at a report. The South Koreans hailed as a model. We've talked about it on this show because they've been able to undertake contact tracing. Contact tracing is somebody catches it. A lot of effort is put to find out who they were in contact with and to test them and test as much as possible. They were even able in South Korea to stage elections, and they didn't see an uptick in the number of cases. But one man is blamed for a spike that was witnessed at the end of last week. On Tuesday, Sanam Shantier filed this report.
On these streets, social distancing rules had been relaxed and most businesses had reopened. But all that changed after a 6-day national holiday in South Korea at the end of April. Today the country is bracing for a second wave of infections. This after new spikes in coronavirus cases linked to Seoul's nightlife, including several gay clubs, which now threaten the densely populated capital. And authorities are scrambling to track and test more than 5,500 people who visited those establishments, but more than half remain out of reach.
연락이 닿지 않는 1982명에 대해서는 기지국 정보, 클럽 카드 결제 정보 등을 통해 확인을 하고 있습니다. 또한 용산 경찰서에서도 추후 역학조사가 충분히 이루어질 수 있도록 CCTV 자료를 확보했습니다.
One of the main challenges this time around, those being tested want to remain anonymous due to the stigma surrounding homosexuality in the socially conservative country. Meanwhile, President Moon Jae-in earlier this Tuesday reinforced the need to practice some form of quarantine.
눈앞의 위기를 보면서 머뭇거릴 여유가 없습니다. 방역 보건 체계부터 시급히 강화해야 합니다.
Now, while South Korea had been hailed as a global model in how to curb COVID-19, it has now become the poster child for the risks of reopening a country.
Yenna Lee, the poster child for the risks of reopening?
I guess so, in some respect. South Korea loosened a lot of its restrictive measures, I think April 20th. It has to be said that there was never a nationwide lockdown. It was never that restrictive as it was in France or in Italy. It was suggested that people close down their businesses. Nobody actually had to. A lot of people remained open during the whole time. Clubs, however, nightlife, they were encouraged to close because they couldn't respect social distancing. And it was in the end of April where some of them started to reopen. And then, as you heard in that report there was a long weekend. Bank holidays kind of stuck together, plus a long weekend. Early May, around May Day, that was when a lot of people went clubbing again, and this second outbreak started off then.
And those people managing to stay under the radar, which is quite surprising, Yenna, when we spoke to one man who 2 weeks ago who had just come back from the United States. He described to us how he was placed under quarantine in a youth center for 14 days. And then there was a nice woman who called him every day to check in, to find out if he had a temperature or not. It seemed pretty thorough. And yet there's all these people who are slipping under the radar.
Well, actually, I think it's when you fly into Korea, whether you're a foreigner or a Korean national, you're put into this kind of strict quarantine system. People who live in Korea already, it's not the case. It's because for a long time, South Korea, I think at one point there were 18 days where there were no new domestic transmissions of COVID-19, which meant that it was only people flying into Korea who have been for weeks now bringing the infection to the country. So that's why they only made it for people coming in the country. For people living already in Korea, there is a wide system of contact tracing, but it's not as draconian as you might think it is.
Let me ask you this, Yenna, because it was the Daily Beast's Seoul correspondent, Don Kirk. He said when he got to the airport, they've obliged him to download this app right away. And is that the case for all Koreans? They have to have a tracking app?
I'm not quite sure that all Koreans need to have a tracking app, but however, if you go to a testing center and you test positive, you're required, I think, to download some form of app that makes you keep in contact with health authorities, and they remind you not to leave the house, etc. They do warn you you're not allowed to leave your self-isolation period for 2 weeks. It's very different when you're already living in the country as to when you're coming in from abroad. I think the quarantine measures, the draconian, some might say, measures that have been put in place have normally, until now, been reserved for people who are coming in from foreign countries.
And just one final point on this. Are the measures popular?
A lot of people have been saying how, South Korea is such a draconian thing to be using, because the authorities do have the right to contact telephone companies. So the 3 major telephone companies that give data based on what cell towers have been telling you about which phone numbers were in a certain area at a given time. They also have access to credit card data. That said, it's not because they have that data that I think police are going to come knocking on your door. For this second major outbreak, the authorities are encouraging people to come forward themselves to get themselves tested. It's not as draconian, some might argue, as per se having to have permission slips to leave your own house, as it was the case in France. It's the question of what you value more, your privacy with authorities or your right to move outside.
So, Anne-Sophie Saint-Père, pick your druthers. Would you prefer the French system where you have to have a piece of paper when you go out the door during a lockdown period? or the South Korean system with this intensive tracking?
We're not going to compare it that way at Amnesty International, but we have very serious concerns about different measures that are put in place. And when I hear you talking about an app that would be compulsory, for us it's extremely worrying, because I mean, an app, as soon as an entity has can monitor where you're going, who you're interacting with, what are your communication, that's surveillance. So if it's compulsory, then we go into mass surveillance, and that will be against international law. And for us, it's very much of a problem, because organizations like us cannot afford to, I mean, we need to investigate certain cases of human rights violation. We need some secrecy, we need privacy. We cannot have the government interfering with who we meet. And that's also the case for journalists, investigative journalists, and that's the case for anyone. So this kind of intrusion will be disproportionate and affect freedom of expression, freedom of assembly. So
what about the promises of a system that uses Bluetooth, that would not store your personal data? Some have talked about that.
I mean, in terms of human rights, it's possible, because the objective, I mean, the right to health is a human right. So you can undermine some other freedoms for the sake of the right to health. Yet it has to be absolutely necessary and proportionate. And we have doubts about the app using Bluetooth. And Bluetooth is not a technology meant to detect a situation of contamination. It's not precise. It can detect another phone through a wall. It's not precise in terms of distance. It has to run all the time. I mean, technically also it will exclude groups such as younger children under 10 because they don't have a phone, or the elderly because they don't have a phone or a modern enough phone. You have to have battery all the time. You have to have a network all the time. And all the people that are asymptomatic will be out of the blue. So we have a lot of doubt about the balance between the potential efficiency and the risks for human rights.
But Anne-Sophie, let me ask you, you're cooped up in your Paris apartment right now. Summer is approaching. If the trade-off for being able to go away on vacation was having this tracking app, would you download it?
I don't think it's a trade-off. I mean, you cannot introduce that as a trade-off, because I mean, it will not prevent you from being contaminated by someone who didn't download the app, or someone who is asymptomatic, or someone who doesn't have a phone. So it's never going to be a trade-off like that. The response is going to be much more complex and wider than just an app. I mean, it's a question also of health measure, of protection of workers, of what kind of services you're going to reopen and how. So, I mean, we're not going to answer to the pandemic with an app. And technically, there are doubts, and you cannot compromise human rights because of a struggle against a pandemic. Anytime there is we lose some human rights, anytime there is a regressions in the human rights systems, it's very difficult to go back to normal. So we have to think twice before we go into a system of control and surveillance.
Let me begin. Let me bring in Dr. Stereos Moskos on this. Okay, again, at the outset of the show, we heard the WHO saying that COVID-19 is here to stay for the foreseeable future. So the only way to live with it is with contact tracing. Tell us what we should do.
I'm going to take heart from the statement that our colleague from the Amnesty International has just made, and it's, health is a right, and we can compromise some other freedoms to maintain our health, but an app will never stop the transmission. And she is 100% sure and correct in everything that she said. I'll add one more little thing. The only way to ensure that these apps are safe enough for all of our other freedoms is to make them open access, meaning that the code needs to be available to everybody to scrutinize, so that there cannot be any nefarious use of said code by freedom-liking nations. Now, if a nation that doesn't actually agree with the principle of a person having the right to actually turn off the app whenever they want to, it's a different matter, and that's where Amnesty International comes in. But what we really should be focusing on right now is stopping this pandemic. We've had thousands of people, millions of people affected from this disease directly, and indirectly, the entire planet is affected by this disease. We are not at the point as yet, in my humble opinion, where we can just put our hands up in the air and say, we failed. No, we haven't failed. We've got people who've lost jobs, we've got people who've lost loved ones, and we have less than 10% of the population in Europe that have been exposed to the disease. We need to hunker down, progress with the capacity to stop this transmission, get to the point South Korea was in 2 weeks ago, and at that point, think very carefully about how we stop transmission. Now, South Korea, for all intents and purposes, is an island, right? It's got a very heavily policed border that rarely people manage to cross, and the rest of it is sea around it. Europe is not necessarily the case, but some parts of Europe are. If we therefore stop transmission in those areas that are island-like in the nature, we can then reopen those spaces in a controlled fashion. And it's almost like putting a fence around the parts of the world that are not able to contain or appropriately contain the disease, and allow the rest of the world to reopen and help them reopen themselves. We don't know if a treatment's around the corner. We don't know if a vaccine's around the corner. What we do know is that it is possible to stop the transmission of this disease. So let's focus on what we can do right now, and then deal with other things that we cannot do in the future.
Yenna-Lee, when you compare South Korea with, say, Singapore, what are your thoughts?
Well, they have different systems of contact tracing. I think I can only speak for the case in South Korea, where it was because of the MERS outbreak a few years ago that they had come up with a law. So lawmakers signed it in a very democratic way, that they would have this kind of access to cell phone towers and credit cards, but only if there was a health emergency. You cannot use this data for, say, for example, for counterterrorism efforts, or any ruse to get into investigative journalism or whatever. This is uniquely supposed to be for a health crisis like we're seeing right now. And they have, authorities in Korea, I think they have tried to adapt to what's been happening very early on when the outbreak first started. They were being accused by human rights authorities in South Korea for revealing a bit too much personal information, making it where you could find out, kind of just using that information, who that person was in your neighborhood. So after being criticized, they did double down, and they're making it a little bit more anonymous. And now with this outbreak happening and being linked to gay clubs in Itaewon, a very lively nightclub area in Seoul, a lot of people coming out saying that people might not be going to testing centers because they fear homophobia and a homophobic backlash, which is very likely in South Korea because it is a very conservative, socially conservative country. And authorities yet again have shown their capacity to adapt to that, because the Seoul mayor and the Seoul health authorities said that they would make testing anonymous now. You can just come with your phone number and get yourself tested. They just want your phone number to be able to warn other people who are standing next to you for a significant amount of time that they should also get tested. They said that the names would be anonymous. And on the day, I read a report that said on the day it wasn't yet anonymous, when they didn't have that assurance, 3,000 people came up to get tested. The day after, when they announced that they would really make an effort to make it anonymous, over 6,000 people came up to get tested. So really, they are trying to adapt to the situation and make sure that it's a safe response to a health crisis. And I do have one extra thing to say. Oh, and regarding the foreign arrivals and the freedom to download the app or not, anyone coming from abroad who doesn't want to download the app, they can just leave the country. And it has happened that people who refuse to be put in quarantine for 2 weeks, they will at Incheon airport, they've been told to go back home if they refuse to do so, and they do. It's their right to leave. So it's not like we're forcing everyone, imprisoning everyone in South Korea. But my last point was, I would like to ask all of you guys, without a vaccine in the world we live in that doesn't have a vaccine yet, can we not live in a lockdown without some form of contact tracing? I mean, is it possible?
And Sophie Saint-Père?
Just to respond about the question of consent, and if you don't want to download the app, you can just leave the country. For us, it's not going to be free consent. I mean, that would be the same that if you don't want to download the app, you cannot take public transport, you cannot use public transport. Or if you don't want to download the app, you're not going to visit your grandparents. Or if you don't want to download your apps, your health insurance will be much more expensive. So, I mean, the consent has to be free and not subject to any kind of condition. So I think we have a different interpretation about that.
And on the issue of the wait for the vaccine, and how do you live in the meantime?
I don't have the answer. I can just tell you what's in line or not with the frame of human rights. I'm not a doctor, and I think also most of the doctors don't have a clear answer on that. I think it's going to be a wide range of measures from health, from capacity for the health system, primary health center, information. I think public trust also. We believe public trust will be key to tackle the pandemic. Measures are much more accepted, are much more efficient if they're well accepted. And we express concern about some kind of repression in promoting the measures in France, police control, and so on. If there is a mistrust between the population and the authorities, the response to the pandemic will be less efficient. That's what we've learned from other epidemics. There should be no risk of discrimination. The public has to be informed.
Sense when it comes to France? How much public trust is there?
I mean, it depends on whom. But for example, if we talk about police control, there are certain neighborhoods and most poorest in France that have been apparently more controlled than the rest of the country, and that contributes to altering the trust between the people, the population, and the police. And then it's the police represent the authority, and then it's much more complicated to explain what will be the sanitary measures, what are the restrictions taking place. For a pandemic, for an epidemic, for health issue, it's very important to have people on board, and to have people on board, it's not necessary. Repression and control may not be the most appropriate solution.
Yeah, Stereos Moskos here in France, they have found that there's been the most police checks in working class neighborhoods where essential workers live. And public trust varies according to where you live. What's it been like in the UK, especially since, and you mentioned it at the outset, that statement last Sunday by the Prime Minister, Boris Johnson?
First of all, I'll say something cultural, if you like. I remember with shock watching La Haine many years ago, and I hope that the situation has changed in France since. But here in the UK, what we hear about is since before Sunday, since Victory Over Europe Day, where we were supposed to be celebrating the end of fascism in Europe, people got out to do these so-called street parties, and a lot of places organized them in a way that they would be safe. You know, people would sit in the front gardens instead of go and mingle in the street. But as anyone who knows the British culture well enough knows, with the alcohol flowing, the groupings became more congested, and people stopped paying attention to social distancing. Then the next couple of days, we had really wonderful weather. I was in t-shirts and shorts over the weekend, pottering away in the garden, but I specifically made sure that I didn't go out in the public. And we got reports of people going out in the parks and the police losing the battle of trying to stop people from congregating in public spaces. Then on Sunday, Boris Johnson made the announcement he made, and then on Monday we had people shoulder to shoulder in public transport in London again. Now, you don't need to be somebody who studies epidemiology to understand that what started on Friday is now perpetuated. And in 2 weeks, it's unfortunate, but it's very likely that we will be in a situation worse than the one Korea is right now. The advantage we have is we don't necessarily have a stigma associated to these individuals. And the point raised that from other pandemics that stigma is not the way forward has been taken into account by both Singapore and South Korea. What I'm hoping is that we're not going to have to go into wave 3 before we realize that, look, this is a public health emergency. It's something that we all have to give up things we like, we enjoy for a small amount of time, however long that small amount of time is, in order to stop pain, death, and protracted damage to economies, to societies, to communities, to countries in the years going forward. Because we don't have a vaccine, we can't say for certain that if you've gone through it once, you won't get it again. And imagine that. Imagine if you've gone through this once, and 2 years from now, your immunity wanes, and there you are again in ICU, out being intubated, because we couldn't be bothered to stay at home over a sunny day. Honestly.
All right, so there's the issue of how to live with the pandemic And we're already seeing, you're calling, Dr. Moskos, for the world to come together at this point.
Yes.
Yet we are seeing, when it comes to finding a vaccine, that already there is, I guess you could almost call it saber rattling. What with the global head of the French pharmaceutical company Sanofi telling the Bloomberg news agency on Wednesday that because there's U.S. investment in it, they will probably get first dibs if they do strike gold and find a vaccine. That's been slightly corrected by the French head of Sanofi since, saying it would only be several weeks later. Of course, we'll make it available to the French. But same as we saw, Stereos Moskos, with face masks, borders come up pretty quickly when they shouldn't in this case.
Yes, and this is not a new story, if you like. In August 2014, when Ebola looked like it was about to spill out of West Africa, everybody was prepared to do anything necessary to stop this outbreak. By December, when the line had plateaued, internationally, then we all had a lot more barriers come up again. So this is nothing new. I think what is necessary here is to look at the example perhaps of other US-based companies where what they did was to strike deals with companies in countries worldwide with licensing in place so that local manufacturing can happen and cater the individual country needs. This is not the time to be making a profit. This is the moment where we restore the planet to its functional capability and think very carefully about what we want to do in the future.
And Sophie Saint-Père, do you have faith in that the planet as a whole, the pharmaceutical companies, national governments will put people before profits this time?
I mean, from my personal perspective, and that's not an amnesty position, I don't believe we should trust the pharmaceutical company because that's not their role. Their role is to make profit. So then we have to rely on government to put health and the right to health first and oblige the companies to comply with whatever is necessary to provide a vaccine or medicine or anything to people.
Vienna Lee?
I absolutely agree with what Anne-Sophie just said.
And on the issue of this new controversy between France and the US, what are your thoughts?
Well, it's kind of sad, but not really surprising when it comes to public health. Each country behaves that way and you always put yourself first. As it was said earlier, it was the same thing with masks. When masks came, we saw those crazy stories about masks being siphoned off on airplane tarmacs to different countries. It really brings out the worst in a lot of ourselves and a lot of our governments.
And right now, what's your mind frame, Vienna, in terms of what the summer next year is going to be like?
Well, I hope things get better, but as it's been pointed out already, it's not because the warm weather comes that things will get better. I mean, I guess all we can do is hope for a good vaccine. It is a bit worrying, though. We were saying earlier about how health is a human right. The right to stay healthy is a right, but how can we make this happen? I mean, there are some liberties we're going to have to give up. Is it going to be our freedom to walk around? Is it going to be our freedom to keep our shops open, businessmen doing their business? Or is it going to be some of your personal liberties or your personal data being given away? We're going to have to make some really hard choices.
One final question. I'll put it to you, Stereos Moskos. The French government this Thursday announcing, because bars and cafes remain shut in this country, but the first ones in the areas least affected by the pandemic will be allowed to reopen in early June. Your reaction?
Okay, I'd like to add one more thing to what Vienna said just now. There's a thing called corporate social responsibility regarding large pharmaceutical companies, and I would extend that to anyone and everyone working on coronavirus right now, whether directly or indirectly, but their business model shifting towards that. If you class yourself as a corporately social responsible entity, you will make no profit out of coronavirus, and all the know-how you will gain, you can apply to something else after the pandemic. But if you are making profits right now out of this, you shouldn't really be allowed to operate in the nations that will suffer from it. Going back to what happens with regards to cafes and the French culture, on that topic, I would invite people to treat their environment not as they treated it before if they choose to take that place. Use open areas, make sure there's a lot of airflow, make sure gloves are changed very frequently, make sure that you are wearing facial coverings because you want to protect your friends that you're going to be meeting there from having something. And much as I love my beer and my home brewing and sitting out in the sun and a little bit of wine, if we need to do that to drink something, let's make sure that's something